If you're bitten by a tiny tick, deep down you know something is not right. Over 475,000 people are diagnosed and treated for Lyme disease. Dr. Tom Moorcroft, he is a board-certified osteopath physician.
If you thought you had the flu and it was, July or August, you might go to the doctor. They've been around for, 13 plus million years. Because you didn't see a rash doesn't mean that Lyme disease is not a possibility. I got joint pain and my brain's not working. I myself would usually start with the botanicals, but do the things that you can do at home, because that's how I healed. 70% of my healing was what I did at home.
Welcome to Khan Klinics, your dedicated space for exploring the vital connections that shape your well-being. Here we dive into everything from achieving peak physical fitness by mastering sustainable weight management to optimizing your diet for a vibrant life. We're passionate about uncovering the power interplay between your mental and physical health, offering you insightful strategies to nurture both. Join us as we unlock the secrets to embark on your self-confidence and your inspiration by interviewing the top-rated personalities, not from only the US, but around the world. At Khan Klinics, our commitment is to bring you evidence-based information that inspires you confidently control your health journey and live your life to the absolute fullness. I'm your host, Amir Khan. Let's get ready to unlock the true potential of being a human with the most amazing people around us. We're surrounded by millions of bacteria and tiny creatures every day. Most are harmless. Some are even essential to our health. But then there are few those stealthy, silent invaders that change everything. If you're bitten by a tiny tick and weeks, months, and sometimes even years later, your world unravels. Fatigue sets in, joints ache, fever, occasional rashes, and an irregular heartbeat. You're told it's all in your head, but deep down, you know something is not right. This is Lyme disease. It's one of the most misunderstood, underdiagnosed, and complex infectious disease of our time. Recent studies suggest that over 475,000 people are diagnosed and treated for Lyme disease annually in the US alone, a number far greater than previously estimated. Even more alarming, many of these patients go undiagnosed, not just for weeks, but for months and sometimes years, without a proper diagnosis, leading to what now recognized as the PTLDS, post-treatment Lyme disease syndrome, a chronic condition marked by fatigue, brain fog, and persistent pain, along with cognitive decline. What are we looking at, and how patients move from survival to healing? What is the missing link? And what have we overlooked? Welcome to another fascinating episode of Khan Klinics. I'm your host, Dr. Amir Khan, and today we have the privilege of speaking with a personality who is helping millions to answer these questions. The most respected voices in the field of chronic illness, Dr. Tom Moorcroft. He is a board-certified osteopath physician, founder and chief medical officer of Origins of Health, a wellness center based in Berlin, Connecticut, where he's transforming the lives of patients struggling with some of the most complex and misunderstood medical conditions. He's known worldwide for his revolutionary work in chronic tick-borne diseases like Lyme's, Babesia, Bartonella, mycotoxin illnesses, autoimmune encephalitis, particularly PANS and PANDAS in pediatric population. Beyond his clinical practice, Dr. Moorcroft plays key roles in professional organization, notably the ILADS, where he serves as the acting president and contributed to the evidence-based fundamental program. He completed his undergrad studies at the Vermont, earned his doctorate of osteopath from New England College of Osteopathic Medicine. He's also the creator of the Thrive with Lyme's Blueprint, a transformative program designed to empower patients to activate their body's natural healing system. As the host of the most popular Lyme Insider podcast, Dr. Moorcroft interviews the world-leading experts and unpacks the mysteries of chronic illness and gives hopes to those who've been told there is no hope. Dr. Moorcroft, welcome to the show.
Thank you so much, Dr. Khan. It's an honor to be here and looking forward to our conversation and shedding a little light on this crazy thing called Lyme disease.
Wonderful. So we're looking forward to this conversation too, sir. For our listeners who might not be familiar with Lyme's disease, please give an overview, symptoms, and the common misconceptions about Lyme's disease, please.
Sure. I think most of us in medical school, we learned about it as summer flu. So if you have, joint and muscle aches, perhaps in the summer, commonly, like you're saying in the intro, the intermittent fevers, a little bit of brain fog. If you thought you had the flu and it was, July or August, and, you might go to the doctor, they would look for a rash. I mean, a lot of people, there's a thing, erythema migrans rash. Most people think of it as a bullseye rash, but unfortunately, that's only a small percentage of the rashes. People get red blotches or just a big red ring, but the rash can be associated with it. And essentially, in the acute phase, it's kind of like you got, a viral illness or the flu most commonly in the summer, but you can see it any month of the year. I think the challenge, though, is if you get it right away and you present with that rash or just like that fatigue and brain fog and headachy stuff, a lot of people are going to pick up on it. But the challenge would be if they don't get it right away or you present like not in the summer, maybe you got bit in August or September by a tick and it's the middle of the winter. Everybody's like, oh, you got a virus or you got, maybe COVID or whatever. But they miss it. Then we tend, more into things like, in increasing joint pain. We definitely get a lot more brain fog. You can have sort of like the dizziness, or like some people get like dysautonomia, which is when you stand up, you get dizzy, and a slew of gastrointestinal symptoms as well. So it can be challenging to figure out. They call it the next great imitator. It mimics a lot of other diseases. One of the key things I think we should let everybody know, though, is you can get it any month of the year. The symptoms can present. But the one big symptom complex that's really important is not just joint pain, but migratory joint pain. So if the joint pain's like in your right wrist, your left elbow, the back of your neck, oh, now it's your right knee. Very few things in medicine will do that. And so if you are having migratory joint pain or even migratory numbness and tingling, that might be something else that would lead you to think about Lyme disease.
Excellent. Thank you for explaining that. So if it is a flu symptom and you've been bitten, and a lot of times you may not realize that you have a rash and you may not be able to see it on your back, the key is it's lingering on. It's not getting better. And all of a sudden, you never had joint pains. And now you have some joint pains here and there. Think about Lyme's. And Lyme's may be the...
I was just going to say one thing is we all look for the rash. We look for the swollen knee. We look for the positive blood test or the tick bite. But that's all, in research, it's only about half of the people. And I think that's the big challenge. I mean, when we deal with people who don't get a rash, or maybe we have a darker skin color and the red rash is missed. So just be aware that just because you didn't get bitten by a tick and just because you didn't see a rash doesn't mean that Lyme disease is not a possibility.
Totally understood. And point noted. Excellent. So walk us through what's your approach now. You have a patient who comes to you and give you the symptoms. You want to differentiate between those who have Lyme's and those who do not. What's your approach? How do you go about treating them? And is it different from the conventional methods that we treat and not treat, but approach the patient, first of all, with Lyme's disease?
Yeah, I mean, the first thing I do is like a lot of integrative medicine practitioners is I look at the foundation of a healthy lifestyle, good sleep, diet, and all those things that I'm sure you talk about a lot, and as an osteopathic physician, we have this philosophy that the body has the ability to heal itself. And so I really try to stimulate or catalyze self-healing rather than try to do all the work for the body. So with that said, in acute disease, I generally start with antibiotics, like in a conventional way. But, I may use a little bit longer because these are slow growing organisms. And rather than treat somebody, say, for 2 or 3 weeks, maybe it'll be 4 to 6 weeks to help to try to just get it out of their system right away. We also know that Lyme has what they call persister forms, and essentially it's the defense mechanism. We give you antibiotics, our immune system's fighting it, and we just want to your body's trying to get rid of it. But the bugs are smart. They've been around for, 13 plus million years, so a lot longer than humans, and they know how to hide. So they have these persister forms, and some of our medications can get to them, but the vast majority of things we know that work for them are botanicals, like herbals. So I generally will, in an acute phase, give somebody antibiotics and then offer them some botanicals to help minimize the risk of chronic disease. Now, if someone's had symptoms for 6, 8, 12 months, or maybe even a couple of years, and we diagnose them with so-called chronic Lyme, or we're trying to figure out, is it chronic active Lyme versus that post-treatment Lyme syndrome? I myself would usually start with the botanicals because that way I can start getting at the low level of infection that's kind of hiding, and then and I ease them into it while we're doing the lifestyle changes, while we're making sure we're opening up detoxification pathways and optimizing detoxification. And then we start to whittle away at it. And then with the botanicals, I find some of our chronic people, that's all they need, but a good number need antibiotics as well. And if I stage it, kind of prepare them, start to treat them with the botanicals and then move to the antibiotics, they tend to, it's almost like you start a little slower to get done faster.
Sure. Makes sense. Before we go on to the next question, it's on a personal note. What made you drawn into treating and going into this field of Lyme's? Any personal journey, anything that relates to you and inspired you to say, well, this is something that's a chronic problem, and there's 500,000 people who are having this.
Why go down this path?
Why go down this path? Because you've got a lot on your plate already.
Yeah, it's interesting. I've always been pretty open to helping serve people who are underserved, and I'm like, if there's a huge group of people that are saying, hey, I'm not feeling well, and a whole bunch of people are turning their back on them, I'm like, I bet you this group of people's got something that's real. It's not like I've never been one to just wholesale buy into big pharma and the guidelines, but I like to critically evaluate it. So in my life, I was teaching outdoor education. I thought I was going to just be an ecologist and a wildlife biologist. I was teaching kids to get them excited about the planet. I love playing outside. I ski and mountain bike, go hiking with my family, play outside with the dogs. And I was at this place called the Institute of Ecosystem Studies. My boss found me staring at a wall one day, and she was like, I left you an hour ago. What's happening here? Why aren't you doing it? And then we both looked down at the same time, and I'm drooling all over myself. Oh, no. And I was like, come to think of it, I got joint pain and my brain's not working. And she's like, you usually get done more in 6 hours than most people get done in 6 days. And she's like, you haven't done anything in the last 2 weeks. And so my boss happened to, I was so brain foggy, I didn't know what was going on. My boss said, hey, why don't you go to the doctor? By the time I got to the doctor, 2 days later, I had a huge rash. It was 1/5 of my body. It looked nothing like a normal Lyme rash because it's usually small, not like part of my shoulder, my chest, and my leg. I go in, he's like, I got you, Tom. You got classic Lyme disease. You got the joint pain, the brain fog, the fatigue. Here's your doxycycline. Take 10 days. You'll be good to go. So I laid on the floor for 4 days, sicker than snot. By 10 days, I was feeling a lot better. And then over the next 8 years, I just had symptoms creep in. And then, I go to the doctor. They're like, we don't know what's wrong with you. Go to the psychiatrist. Like you said, they say it's in your head. Went to the psychiatrist. Oh yeah, major depression like your dad. None of the meds worked. Like, oh, I know you've got that type 2 bipolar. I was in medical school. They're like, oh, all the good doctors and lawyers have this. I'm like, I don't know many doctors that are bipolar, but okay.
Yeah.
Tried the meds, they didn't work. Then somebody came up with the brilliant idea that I had ADHD. I'm like, well, yeah, that's true. We knew that since I was born. That's a superpower for me. That's not the problem. And it doesn't cause aches and pains and brain fog. So ultimately, I got diagnosed with chronic fatigue and fibromyalgia. I almost went to punch the doctor because I said I had joint pain, brain fog, and fatigue. And he goes, you have joint pain, brain fog, and fatigue. I was like, they give me no understanding of what was causing my illness and no hope to get better. So eventually I went on my own healing journey, and then I was about 70% better. I did a medical school rotation where these two doctors were treating hands-on osteopathy, doing naturopathy, as well as treating chronic Lyme. And at the end of the first day, I'm like, oh my God, all these people sound like me. I finally have heard someone for the first time in 8 years that sounds like me. So I didn't feel isolated anymore. Then it turns out I had Lyme and Babesia. They treated me, and then I got better after about 4 years. And then I went into clinical practice. I was like, I wanted to be an osteopath to do hands-on manual medicine, a little bit of lifestyle, maybe, some mindset work. And I was basically hoping to get paid to meditate all day by doing energy work, Yeah. And, one of my first patients, I put my hands on her and I was like, I can't fix this with my hands. You have an infection that needs treatment. Because when I was trained, a lot of the osteopaths are like, when you're in the hospital, learn what infections feel like, learn what medicines feel like, etc. And so I was like, I didn't know who to send her to, and I didn't even want to get into it, but I didn't want to leave her to her, I didn't want to toss her out in the street. So I did some testing, found out that she had Lyme disease, started treating her. She referred a few friends, one of whom was in a wheelchair. That particular person got out of a wheelchair in about 2-3 months. And the rest is history, because as soon as you get somebody out of a wheelchair, your practice kind of blows up. And it's been 15 years of doing that.
Excellent. So it was a personal journey, personal experience that drove you into this path. And you're on a path now, and we appreciate all the work you've done. Tom, you've taken a unique course. You've incorporated integrative and holistic approaches for patients with chronic illnesses and chronic symptoms. Walk us through, how is it helping patients using these approaches versus the conventional medicine?
Yeah, I just went back and I had this crazy idea. I said, do our antibiotics sterilize our body? And I went and I asked like over 100 conventional doctors, because when I started, I was still working in the hospital. And I said, does the antibiotic get rid of the pneumonia? And 100% of the doctors I spoke to said, no, it lowers the level of the infection until the immune system recovers enough to do the rest of the job. And I said, well, that's really interesting, because that's what they taught me in medical school. And that's what my observation has been. But why don't you treat people like that? And so I just learned about, this self-healing mechanism and also supporting the body. And so I found that our job as physicians and other healthcare practitioners, and even as like parents and good stewards of our own beautiful divine bodies, is if we help the body to function at its optimal level, it will heal quicker. And so it's not like in my healing journey, I changed 70% of it was changing my lifestyle, doing things that moved the lymphatics and detoxified, improving my diet, changing my mindset. But I still needed the doctors. But when I got to the doctor, that combination of sort of what at the time, I didn't know it was functional and integrative medicine. I hadn't been introduced to it. It was like I just had the kicking and screaming. I had to get better, And so when I brought that into my world, I found that people who are living the standard American way, kind of this very Western approach to things, typically aren't as healthy as they could be. And so they're starting out behind the 8 ball. And then if they get Lyme, now they have the double whammy. So I'm like, I just look at it like this. Like, I can hold so much toxicity, and right now my water glass is here. If I'm here and I get that, not too bad. I can do a little work here. But once it overflows, then I have a challenge. So when I'm in that overflow state, I want to just remove any major, toxicity I can, which could be stress, mental, emotional, physical. A lot of the people I see are very type A. They're driven. They have families. They exercise a lot. And sometimes they just need to turn it down a little and understand that sleep and rest and recovery are part of it. And basically, I just said, like, it's not that it's all of one or none of the other. It's like, hey, some people diet's a really big part. Other people, it's improved their sleep. Other people, they just need antibiotics, you know. But I love the fact that we can understand how the body functions, sit down with that unique individual in front of us, and then we have that opportunity to find out what their unique healing pathway. So we have guidelines in conventional medicine and functional medicine, and we use this to help us understand how to help somebody as a unique person. And that's really the fun part, because I get to know people really personally, and oftentimes many people in the same family. And then you really can see these impacts on people. But as a quick example, I'm working with a gentleman, came to me because he was diagnosed with Lyme disease and another infection called Bartonella. And he had mold exposures. But part of the problem is in his 30s, really severe obsessive compulsive disorder, or OCD. He has to wash his hands all the time, and he often wants the kitchen sink running, which floods his parents' house all the time. And we were working, and anytime you gave him a little bit of treatment for his gut, like a probiotic, it would really flare things up. And he would do okay on Lyme and Bartonella treatment, but he really could never fully tolerate it. And then I just said to him one day, it sounds like you've got a lot of mold and or yeast in your gut. Let's treat you with an antifungal to clean up your gut, so that then we can clean up the other infections we found. And we started to work on his gut, and I gave him an antifungal. And within 2 months, he was like 70% better from OCD of over 20 years. But if I had only focused on Lyme disease rather than him as a whole person, he'd still be sicker than snot, right? And so now we rebalanced his colon, we got rid of some of the yeast, and now he's able to layer in the Lyme treatment and actually see benefits on both spots. So I really try to find kind of like what's keeping you stuck, what's the thorn in your side, so to speak, remove that, and then work with the natural healing principles.
Yep, brilliant. So having said that, there is a component of the mold infection that you presented in, that treating that, even though you have a chronic illness as Lyme's, helps a lot. Tom, tell us, or our audience, please, what are some of the challenges that you face in diagnosing Lyme's? And with that, the second part is, what's the advances that you've seen in diagnosis of Lyme's? Are there any?
Yeah, I think the big thing we see is the testing that's most commonly available isn't really all that accurate. It's essentially in studies shown to be a 50-50, meaning if you have it, 50% of the time blood tests will show you have it. 50% of the time it'll miss it. The symptoms are tough, because if you happen to be one of the many people, over 50% of people in studies, that don't get that rash or don't get a swollen knee, now you're left with fatigue, brain fog, joint pain, maybe the occasional headache or fatigue, chills. That sounds like everything. Sounds like the flu, COVID, and then you get thrown into this chronic fatigue. So it's challenging because a lot of the symptoms are non-specific. And so then when we look at testing, we're trying to look at your body's immune system reaction to the bug, and that's an antibody test. Those are less expensive and easier to get, but they're the 50-50 ones. The challenge with all that is, if you do it at the wrong time, or you don't even know to do it, you're going to miss it. And, that's a part of the problem. And some of the other tests are very accurate, but they're not sensitive. So they miss it a lot because they're looking for an organism floating around in your blood, but they live in your tissue. So there's diagnostic challenges from both the non-specificness of a lot of symptoms, and then also the blood tests are not as good as some of the authorities would like you to believe. And all this is, in the medical literature, people have studied it over and over. But when you talk about future directions and like the improvements we're seeing, this is where I get super excited. The last 5 to 6 years, we have had so much more research on what it looks like, what the tests are, improvements in testing. And in fact, like through COVID, certain types of DNA or genetic testing, which would be more direct, grab the organism and say, we found it in your blood. There's been really huge advancements. So while that's not a first line testing procedure, it's improved tremendously. Recently, one of our specialty labs has worked to introduce an improved technology for detecting Lyme disease in antibodies called it's a special type of immunoblot. But what's interesting is they worked with the FDA, and usually to get a test or a medicine covered, you have to prove that it's at least as effective as everything out there, but it's not worse than anything. But what these guys did is they actually upped the bar, and they improved on the current technology dramatically to the point where the CDC and the FDA have now changed the Lyme diagnostic criteria on blood tests, so we're less likely to miss a true positive. So with technology and advances in precision, using kind of computer learning and better technologies to separate, because we're basically separating out proteins, and we need to look at them. And so it's kind of like blurry versus not blurry. So we have a lot more not blurry tests, which give us much better answers these days. So they're not perfect, but we've made dramatic improvements. I mean, even in the last 2 years, it's just skyrocketed. So, and that's just a huge benefit to the patients. They get diagnosed and treated sooner, and the clinicians are coming up with, you know, more accurate diagnoses these days than ever before.
Excellent, and that's very encouraging. Thank you for explaining that. That's quite a nice answer. Let me move on to the next question, Tom. And this is about cognitive impairment, the significance of not the lymphatic, but the glymphatic system in healing chronic illnesses. Shed some light on this for us, Tom, and explain to our audience what do you mean. What do you mean by glymphatic system in healing these disorders?
So the glymphatic system is essentially the detoxification system of the brain. In the rest of the body, we call it the lymphatic system. Researchers, you know, give a nod to some of the other nuances inside the head that are a little different. But the bottom line is it's the way we take out the dirty water, right? It's the drainage from the brain. In the arms and the legs, the lymphatic detoxification system works through muscle contraction, moving our arms, exercising. In our chest, in our belly, in our pelvis, the primary mover is pressure gradient changes. And another way to say that is deep breathing. So when I'm moving and exercising my arms, and maybe I'm getting going, I get breathing deeper, I'm detoxifying the whole body. But there's the brain part. And what they found was the brain actually primarily detoxifies something like 80 to 90% during sleep. And it needs to be deep sleep, not really disturbed sleep. So what's really cool to me is if you want to sleep really deeply, you should get up in the morning and get some natural sunlight because you'll have more energy during the day, but it'll also your pineal gland in your brain to create melatonin. And then at night when it's dark and you cool your room down a little bit and the noise goes down, then that's a signal to your brain to release the melatonin. Melatonin is one of your primary sleep hormones, and then that can help you get really good deep sleep. Now, in order to do the rest of detoxification, the breathing and the muscle contraction more optimally, we would exercise. But the beauty of that is if the more I exercise during the day, the easier it is for me to get tired and sleep effectively at night. So the body has this really unique mechanism. If I focus on getting up in the morning, getting a little natural light, exercise sometime during the day that fits in my schedule and works for my physiology, then I do a little bit of relaxation right before bed, maybe a little breath awareness or prayer, a little journaling. Now I can drift off to sleep. Now my brain detoxifies. And, you know, when I was sick, I mean, my biggest thing was if I slept 4 hours or 14 hours, I felt terrible. And then I learned a little bit about sleep and sleep hygiene. So I just like, I don't know what else to do right now. This is before the diagnosis. I'm like, I'm just going all in on me and my future. And the only thing I know I can start with is sleep. So let's try that. Worked on that, started doing a little yoga. And the combination of the physical exercise that was what I could do at the time, because it wasn't a lot then, allowed me to then sleep better. And I did a little sleep, a little exercise, a little more sleep, a little more exercise. And we just kept ratcheting it up slowly as my body healed. And on my body's timeline, pushing a little, but not too much. And then I was able to sleep. And so what we find is a lot of our like mold illness, strep, and even probably Lyme to some degree are triggering autoimmunity in the brain. And we're seeing a lot of breakdown the blood-brain barrier. We're seeing inflammation in the brain. And so a lot of people are like, how do I detoxify the brain? How do I bring the inflammation out of the brain? I'm like, most adults need 7.5 to 9.5 hours of sleep a night, no matter what you tell me. That it's been studied over and over and over again. And if you focus on your sleep, which includes, planning out your whole day a little bit, it really helps. And one of the tricks that helped me that I've learned more recently, because, once you get better, you start to get a little lazy sometimes, to be honest, is I have a coach who tells me, he's like, look, I get up before every day and start my day. I go, well, that's a little too early for my taste. But his point was, I get up without an alarm. Like, how the heck you do that? I've always been kind of a night owl, but we do know that if you're getting to bed between like 10, 11, 11:30 and you're giving yourself that's optimal for most adults. So his tip to me, and I'll share it with you guys, is set an alarm to go to bed, not necessarily wake up. And for me, I started with both, but I find that like a lot of times if your sleep is poor and you don't feel well, you tend to stay up a little longer, a little extra scrolling, a little extra TV. So I find it really cool, set a little alarm and go, hey, my alarm goes off at 9:30, I'll be in bed by 10, and it really does seem to help. So brain detoxification primarily is sleep. So definitely focus on it.
Brilliant. I think that's, and the tip as well, because it makes total sense. And I tell my patients the same, is that it's time to put your mobile phone, don't take it in the room, because that's when you're going to start to procrastinate. And
yes,
set your alarm half an hour and start to wind down. You need to start winding down, because the next phase is actually not the end of the day, is actually the beginning of your day. The beginning of the day means you start your day with this good sleep, and then you'll do the rest of the day better. So thank you for explaining that. Tom, I want you to tell us about the future developments that you see in your field of integrative medicine and treating complex chronic illnesses. What's your thoughts, and what are you seeing?
What I'm seeing is a more acceptance of how the body actually works, and more patients are looking for holistic healing. More patients are we're in a consumer-driven society, so researchers and big pharma to some degree are starting to listen. But when I go to these conferences where scientists are looking at their research, they're finding out that a lot of the people in the integrative medicine field, the chronic illness field, what they've been saying for 5, 10, 20 years, we're starting to get the science to support it. So what I'm really excited about is moving forward, especially with AI and all this big data and stuff. Maybe not everybody likes it. And I certainly have questions about, ethical use, but we're able to study much more quickly. And what I'm seeing is that people who are never open to this are starting to question, why are we living in this diseased society? And why are we always focused on just keeping people sicker longer, where they're really getting an interest, both, from the consumer perspective, the patients, all of us at home, as well as the researchers, and like, hey, wait a second. There's actually evidence that this stuff is real and it works if you do it. So I think what we're going to see, and maybe this partly is social media and podcasts like this and YouTube, but we're starting to see that more people are interested, and for better or for worse in our country, the more people who are interested in it, the more the powers that be have to start to listen. And having been affected by this since 1997, until I got better, and just so everyone knows, I've been better for over 13 years. So I know you actually can recover, even though it was 8 years till I got a diagnosis. I think that's actually key. You can get better. But the other part is, having been in this field professionally for over 15 years, the last 5 years has been this huge inflection point, rapid change, better diagnostics, better studies, more interest, better treatments, and more natural treatments are being integrated. So I just find it like it's almost like we're at the tip of the iceberg, but we've also kind of gotten that snowball to the top, and it's starting to gain its own momentum. And as a parent, as a patient and as a provider, that really inspires me. In fact, my little tingly, like my hair doesn't stand up on my arm, because it's like there is actually hope now. And the beauty is, when you do say, I have something going on, maybe the first 10 people don't listen to you, but number 11 or 12, they are out there and they're here to listen. And it's like folks like us doing this work, I think we're getting more and more access to care, and we're able to share more and train more people and just inspire. And so I'm just really glad to have an opportunity to chat about this, because I think like 12 years ago, I would have said, we're fighting a really bad uphill battle. But now it's like, man, we're having breakthrough after breakthrough. And what used to take 7 or 8 years to get the next breakthrough, we're having a breakthrough every couple of weeks, a new paper every 7 weeks, So I'm really excited about it. We're making much better progress now than 10 years ago.
Excellent. And there's obvious incredible passion that comes out, and when you speak from your heart. So Tom, your final message to our audience.
Yeah, when you're looking at all of this information, learn from other people's journeys, but go on your own. Don't compare yourself to other people, because a lot of people I work with say, hey, I'm not doing the right thing because my friend did something else. Well, but they're somebody else. They have a unique journey that's theirs. And so I would say, focus back in on yourself. And then also, our society tends to reach outside. I need the next greatest gadget. I need this pharmaceutical. I need that herb. Start by looking inside. Take back the control for healing. Take over the things that you can do. Pray, gratitude, mindset work, breathing, focus on calming your own nervous system down. Focus on your day. Start, like we were saying a second ago, starting in the evening so that you can wake up with energy. But do the things that you can do at home, because that's how I healed. 70% of my healing was what I did at home. And then when I got to that last 30% and I needed the doctor, my body was ready to go. I was at the best place I could to receive the treatment. So I would say, each and every one of us is this unique light. I would encourage you to know that you are worthy to receive healing. You are worthy to receive joy and love in your life. And I would open your heart, because right now the world is a super cool place, but we need a little more light. There's a little too much darkness for my flavor out in the broader world. So if you shine your light and you take responsibility for yourself, you'll motivate people around you to do the same. You'll give them permission to shine their light, and together we can all help each other heal. And especially, one last point about to parents, a lot of times you want to get your kid to do something, they're watching you. So go back, lead by example, inspire others by taking care of yourself first, and then show up 100% for them. And, hopefully everyone will be sending us little chats about, and little DMs about how they took our advice, took care of themselves, and got better.
Absolutely brilliant. Dr. Moorcroft, thank you for not only sharing your incredible expertise, but also the brilliant compassion and clarity you bring to such complex health issues. Your work is truly making a difference, and we're honored to have you. Thank you again for coming on the show.
Thanks for having me. It's an honor.
What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Klinics.